So after finishing all this thing, you guys are planning for AMC Clinical. So AMC Clinical. So just giving a short demonstration now how usually we do that. So usually our live classes goes on, and at the same time we give the materials through the Google Drive, and this is how our Google Drive looks like. Let's start with the ebook things. Few things I put as 5-star, as you can see, because AMC Handbook Clinical Assessment is a 5-star thing. Karen Note I put 5-star because all of us, no matter if someone tells you that I never studied Karen Notes, and that will be a wrong statement. That's like one of the main thing. Yes, that's like one of the main thing in the like I would say Bible in John Murtagh in the part 1. So Karen is the main vast thing actually. Every type of note you will find in the Karen notes. Okay, then the Marwan that came lately, it's more organized. I mean, taken from Karen, taken from student mouth, and the thing there he has organized. That's the Marwan one. Then on the MC clinical exam guide, let's see what's inside here. All right, AMC exam preparation timeline. Okay, clinical always focus on getting resources first. Budget calculation, this is another important thing. Time, I mean, should plan. Then English test, visa application. And before exam, I always remember, I mean, I told you guys that always visit the exam center. I mean, outside, but it's okay. Like, there's a few points actually. And so, I mean, these things will be there, don't worry. AMC handbook cases. Murtagh's Patient Education, this is another book. Not the John Murtagh, I mean the 7th edition. This is a Patient Education. Currently, 8th edition is going on, and we also have the 8th edition. And here, I think I uploaded the 6th, but currently 8th edition has came up actually. Yeah, but the soft copy of 8th edition we don't have yet. So this is called the Patient Education, another book. Murtagh's Practice Tip. This is another different book, not the same John Murtagh 7th edition. You guys have read, that's different. Pediatric Handbook. This maybe you heard a little bit. I mean, mostly full of RCH guidelines. So this is another resource, RCH guidelines. Either you can Google it, RCH guideline, or either you can read from the books for the pediatric cases. Now, physical examination, you see PEPP means also the physical examination. I mean, most of us, India, Bangladesh, Pakistan, we have read either McLeod's or the Hutchison, isn't it, guys? I mean, what you have read, Dr. Rinha, Dr. others, I mean, in past, Dr. May, what you have read in past, Dr. Nirali?
Hutchison.
Hutchison, okay, Hutchison or McLeod's. Any other book other than this, anyone? Or is in between Hutchison or the McLeod's? Anything different? Dr. Mo, what was your book in the medical school 5th year? Physical examination. Okay. Anyways, I mean, physical examination, I mean, I put the McLeod name because one of the book, I mean, the old book, because it has good vibe, good impression in us, actually. We remember the things easily. This is one of the point. We remember the thing easily, that's why McLeod's, but the main book for physical examination is Tally O'Connor. Tally O'Connor. Then Sushan Warren, this is another one, but there's a Tally. This is one of the main book for physical examination. Please do mind this thing that, you know, the PEFE is also included. I mean, but you know, the system of delivering is little different. PEFE is normally you have to ask the examiner. I will give you guys demonstrations soon. I'll be uploading series of videos in MC Clinical. So I'll be also giving you all some more tips how to do PEFE. What is the difference between PE and PEFE? I will tell you that one as well. Physical examination list. There's a list you have to do regular physical examination actually. and DD and mnemonics. Now you have to remember lot DD because child with rash. That has to 5 point has to came in your mind when someone said a person who is having headache, pregnant lady having headache. I mean there has to be 5 DD immediately hit your brain. Okay, so that is how we need to proceed, and according to that, we need to read. One thing that is not included here, there is another history book I have. When people join, I gave that one too actually, so they usually read that one as well. So this is going the so do you guys get, I hope so you guys get idea about the books actually. Yeah. Now, if I show you some of the recordings we have actually, each recordings are the similar like the MCQ, almost like 3 hours. So starting with say, okay, so I can see, all right, gynae, then medicine again, obstetrics, pediatrics, including in the beginning class, I give idea about the history, how to take the history, then the pediatrics, then comes psychiatry, then comes this surgery actually. You can see some of the names are given because some of the tutor can be different. But if the subject's the surgery part, pediatric, I took it. Gynae was taken by Dr. Qureshi, she's from Hill. Dr. The Sam is also from Hill, and Alan both, very famous tutor. Yeah. The medicine is taken by Limon. Limon is also working in Brisbane, good doctor actually. Yeah. So so this is how we differentiate it. This is how the things are taken. And if I show you some of the notes, like for example, let me show, okay, one of the my one, let me show you pediatric note. I know how we have organized. So I was talking about child with rash. Let's show this one. So this is how it looks like, child with the rash. And so initially book references pages are given. What are the cases in handbook? Same like the MCQ. Popular clusters from the pediatrics. All right, the one we are going to cover today. All right, so child with rash, 2019-20 cases. See how I organized the things. These are the cases that have been tested in 2019 and 20. But if you count child with rash, the other years, there could be more cases. So your target first to finish these 5 cases from the child with rash. All right. Like see, if anything new came up, I also add that one in that way. Our MC clinical is probably even more, organized because it's like a thing. Imagine a city that is developed later, more well built. So this you will feel like it's more well built actually. The things are already. So candidate feedback, certain things I was. Um, so yeah, so this is how the cases. When I ask someone for role play, before that one, I show the case for 2 minutes. Then they start practicing with me. Then came the diagnosis. Yeah. So this is how we proceed with them, and we also give explanation to them. Say this one was a case of uh, can anyone guess what is this case can be? Fever, skin rash, any idea? A lot of things can be. We also need to take history of lymph node and these things. So it turned out to be later Kawasaki disease, but actually after taking the history, when we ask the role player, then we get to know, okay, this thing happened. The rash came after the fever. Lymph node was enlarged. Lymph node was more than 1.5 centimeter, and the skin is looking discommission, and that is we confirm from the examiner, and after that we proceed with the patient actually in that way. All right, and this is the commentary. These are the thing you have to ask. This is the thing you have to ask the patient, the role player that's there. Do understand there is no real patient inside, all are actors. Physical examination. So this is the physical examination. Either you have to do it or either you have to ask the examiner. So in this case, there is no real child. Remember one thing, there's no real child in the exam hall. So you have to, this is PFE for sure, physical examination. So we just do one thing. So for example, Melissa, I'm turning to my examiner to ask few questions and I'll be coming back to you. Is that okay? So role play will say yes. So we'll turn to examiner and ask these things. Then I'll ask about the general examination. I'll also ask about the rest. I'll also ask about a little bit about systemic examination. Okay, so these are the key points. Then the investigation and the management. I arrest my case in that way. Like IVIG, I highlighted. If you don't tell that, it's a gross error in the like yeah. All right. So this is how the things are done actually. This is one of the slides. This is just the pediatrics, and even the medicine is also yeah. Limon usually take it. The pediatric. For example, sugar, respiratory, pulmonary, lemon. So he's also tutoring under my academy, and he's also tutoring in Allen. So it is like a lot of tutors are quite similar. Only difference you will find the budget if you go to Australian one, and my one is budget difference is huge. That's the only difference actually. And nowadays everything is online. So Limon is also my friend, and his slides are also fantastic actually. Yeah. So this is how things are given, and so we have organized well, and if anyone join, they will receive these recordings. For now, and whenever we'll start the live class, they can join again. So that is how the plans are for us now, because there is no reason I should run the class right now, because the MC exam there is no announcement actually, so that I cannot put pressure actually. Yeah. So any last questions? So this end of question answer. Any last questions from my doctors? All right. And before you all left, I'd like to congratulate you all again, and good luck with that one. And sorry, actually my Zoom was turned off, so I missed the email. If anyone has given Dr. May, sorry, I have missed your email because the chat history was gone actually. So if you can give your Gmail one, I can send you again that the how to apply for the doctor's job. Yes. So any last question, anyone? Or good luck to all of you. We can unmute and tell all each other good luck. And since some of the doctors are here, I would recommend you guys should work as a team, 5, 6 doctor, a group you guys can make, and you guys can keep discussing about materials, planning, things. It's not necessary. Not everyone has to be in the same institution, but different people, different institution. Make sure you finish everything. All my request, whatever you do, you join me or join others, doesn't matter. Make sure you finish this MC clinical as soon as possible. That's my request to all. So good luck with that one. All right. So thank you, everyone. Thank you and good luck. I'm turning off screen now. Good luck.